I can't stop chewing on ice. Why am I craving dirt? I know I shouldn't be eating this, but I can't help it. Why is this happening? If you or someone you know has ever experienced similar thoughts and feelings, it may be due to a common but generally unknown eating disorder called Pica. Eating disorders are a class of psychiatric conditions in which individuals experience severe disturbances in their eating behaviors, related thoughts, and emotions. When you hear the term eating disorder, it's highly likely that anorexia nervosa, bulimia nervosa, or binge-eating disorder come to mind. Many fail to realize that there are several other clinically recognized eating disorders that are just as significant. Pica is a type of eating disorder in which people compulsively eat non-food or non-nutrient items. These often include ice, dirt, paint chips, and clay. The prevalence of pica varies widely across different social and clinical contexts. However, cases appear to be higher amongst pregnant women and children compared to other groups. Globally, pica is estimated to affect 25 to 35% of children and up to 68% of pregnant women. After learning more about this condition, one question probably comes to mind. What causes the craving and ingestion of non-food items? Doctors are unsure of what exactly causes pica. However, it's more commonly seen in the following individuals. In many cases, a deficiency in iron, zinc, and other essential nutrients may be associated with pica. However, discussions surrounding this association are often of the chicken or the egg variety. Which came first? Does nutrient deficiency cause pica, or does pica cause nutrient deficiency? Many studies believe that pica is an effect of nutrient deficiency. Research has shown many cases of individuals who spontaneously developed uncontrollable cravings for ice after being diagnosed with iron deficiency anemia. These cravings completely disappeared after only 5 days of iron supplementation. On the other hand, some studies suggest that pica may actually be causing the nutrient deficiency. A diet consisting of mainly non-nutritive substances can prevent the body from obtaining essential vitamins and minerals. For instance, the ingestion of non-food items such as clay or starch can actually interfere with the body's ability to absorb iron. In addition to nutrient deficiency, another prevalent cause of pica is pregnancy. It's estimated that 27 to 68% of pregnant women experience pica. In fact, one of the first cases was observed in a pregnant woman in 6th century AD. A recent study conducted in Ghana reported that 67% of pregnant women ate non-food items due to strong and uncontrollable cravings. 51% said that these substances reduced their feelings of nausea and vomiting, and 45% reported enjoying the taste. Although the true cause of pica during pregnancy is undetermined, many believe it develops as a result of the aforementioned nutrient deficiencies. Pregnant women are at an increased risk of nutrient deficiency, particularly in iron, as the requirements increase in order to support fetal growth. In most cases, pica cravings usually subside after childbirth. Pica has also been attributed to developmental disabilities, where intellectual disability and autism are the most prominent. So much so that studies suggest 5 to 25% of children with learning difficulties have pica. Although it's an independent behavioral issue, it tends to be labeled as a symptom of other conditions. Obsessive-compulsive disorder, for example, where uncontrollably eating non-food items to alleviate stress is a form of pica, and reports show this behavior to be true in those with OCD. Pica has also been linked to schizophrenia, where those experiencing delusions may impulsively eat non-food items. Cultural pica is also a contributing factor, where eating non-food items is not only acceptable but a common practice and learned behavior in several communities and cultures. In some parts of rural India, eating items such as mud and clay are believed to carry health benefits and spiritual effects, whereas the Chaga group of African females believe eating soil is associated with reproduction and fertility. Pica is a very dangerous condition that can lead to some pretty serious complications. Mentioned here are some common consequences of ingesting non-food items. However, the type and severity of complications depends on the substance ingested. For example, since paint chips contain toxic substances, consuming them can lead to lead poisoning, which is often linked to brain damage and death. Other commonly ingested items such as hair, stones, and glass can cause intestinal blockages and potentially damage the lining of the digestive tract. These complications become especially worrisome when the patient is a pregnant woman. As the mother's diet is an important component of the growth and general well-being of the fetus, consuming non-food items can have serious consequences for both the mother and child. Currently, there are no specific tests or treatment for people who have pica. However, some treatment approaches include preventative, educational behavior control combined with nutrient treatment or mental therapy. In some cases, severe patients may undergo pharmacological treatment. Oftentimes, pica goes unnoticed due to embarrassment or a personal belief that it's not worth reporting. However, everyone deserves to receive the attention they need, and seeking out treatment is on the path towards that. Hopefully, we've provided you with some useful information. However, this video is just an introduction to pica. If you or someone you know have concerns regarding pica, please seek advice from a healthcare professional or reach out to the following helplines.